Fluoride. It is hailed by the Centers of Disease Control and Prevention as one of the 10 great public health achievements of the 20th century. In fact, for over 60 years, the American Dental Association has stated that brushing with fluoride toothpaste will prevent tooth decay. But is this true? Is there more to the story than what we've been told?
Triumph over tooth decay. Procter & Gamble announces Crest toothpaste with Fluoristan, its exclusive fluoride compound, world's greatest weapon against decay.
Look, Mom, no cavities.
Yes, Crest toothpaste really cuts down cavities because Crest has fluoride. The same fluoride dentists put right on teeth to prevent decay. With Crest, you put this fluoride on your teeth at home, too. Prevent cavities. Use Crest.
Crest is accepted by the American Dental Association.
Today, 95% of the toothpaste sold in the United States contains fluoride, and 72% of all water is fluoridated.
Fluoride is safe and effective, and it's one of the most inexpensive ways to really cut down on dental decay.
Anything we can do to help prevent cavities on children, I think, is very important.
Absolutely, fluoride is safe. It's effective.
Fluoridation of community water is extremely safe and extremely effective in preventing tooth decay. Science is on the side of fluoride being safe and effective. There is no controversy about this in the scientific community.
If it's such a simple issue, how is it that it's still going on after half a century? I remember it being debated when I was
30 years ago.
And it's continuous debate.
But just because we've been doing something 50 years doesn't necessarily mean that it's right.
Public health officials knew then what they know now. Would we have fluoride? Would it be added to our drinking water? Well, today a coalition of scientists, dentists, and doctors are taking action to stop fluoridation until it is proven safe.
The first widespread commercial use of fluoride was for the eradication of vermin. Since the 1800s, sodium fluoride has been a key ingredient in rat poison and insecticides. These products were commonly used in and around the home to kill lice, mice, rats, and insects. Fluoride proved to be not only a good way to kill rodents, but also an effective way to kill a man. As the use of fluoride became more popular, reports began flooding in of people dying from ingesting this toxic substance. Headlines screamed, "Roach poisoned in pancakes kills 11 men. Rancher takes dose of poison by mistake." Article after article, all having the same tragic endings, proving that sodium fluoride can and does indeed cause death. In fact, during the last part of the 19th century, the Industrial Revolution was taking hold of the modern world. An unfortunate byproduct of this technological revolution was that it created the most toxic pollutants known to man. And the most hazardous and destructive of them all was fluoride. In his award-winning book, The Flouride Deception, investigative journalist Christopher Bryson examines fluoride's disturbing history. Bryson notes that in its early days, fluoride was a widely known and well-documented killer. Documentation from early lawsuits against fluoride manufacturers clearly shows that fluoride was a hazard, not only to humans, but to the environment as well, with damages reaching into the tens of millions of dollars. By 1930, the aluminum industry was the largest and most influential fluoride polluter. Industrial giants such as Alcoa knew they had to do something. Vegetation and livestock near Alcoa plants were being decimated as toxic fluoride fumes lingered, rendering nearby cattle lame and crippled, even causing death. One newspaper article from that time proclaimed, "During the past year, we had 51 head of cattle die. We had laboratory tests made, and these tests show excessive amounts of fluorine in the liver and kidneys. Also, some of our young cows had lost their teeth. Our saddle horses were so crippled from fluorine poisoning, they had to be shot." The serious nature of fluoride toxicity was beginning to be realized. As a result, fluoride's threat to corporate America was laid out in an exhaustive review conducted by the U.S. Department of Agriculture. Toxicologist Floyd Dietz warned of new medical information exposing fluoride's harmful effects. Danish scientist Kaj Roholm singled out the aluminum industry, specifically Alcoa, as the source of much of the fluoride poisoning. Fluoride was causing irreparable damage, and the word was getting out. Alcoa knew they had to act fast. their high-powered attorneys sprung into action, quickly buying up farms and paying out settlements. Ironically enough, during that time, the U.S. Public Health Service was under the jurisdiction of the United States Treasury Secretary, Andrew W. Mellon. Mellon was the founder and major stockholder of Alcoa. He was also the founder of the Mellon Institute, an industry-funded research institute that was notorious for giving corporations such as Alcoa the scientific data they needed to defend themselves against lawsuits. The Mellon Institute published questionable and self-serving evidence that supported the effectiveness of fluoride in fighting tooth decay. In doing so, the Mellon Institute rats had put a smiling face on what had been a scientifically recognized environmental and workplace poison. It was an aluminum industry-funded scientist, Dr. Gerald Cox, who worked at the Mellon Institute, that first made the proposal to artificially fluoridate public water supplies. Mellon's economic interest in fluoridation was obvious. Fluoridation provided the chemical industry an opportunity to void liability of their poisonous fluoride waste by means of promoting it as a health benefit. The official human experiments began in Grand Rapids, Michigan on January 25, 1945. 107 barrels of sodium fluoride were delivered to Grand Rapids, where city technicians began tipping them into the city's water supply. They were the first to publicly fluoridate their water. It was to serve as the test city, and its tooth decay rates were to be compared with those of non-fluoridated Muskegon.
The study only lasted 5 years. There are no permanent teeth in the child born at the beginning of the study. It was an unblinded study. They did no measure of safety, and they claimed that there was a tremendous benefit to the permanent teeth. Well, there weren't any permanent teeth in the children who were born at the beginning of the study, and soon thereafter they fluoridated Muskegon, the control city. It's a phony baloney study used to demonstrate the benefits, where there are none.
Unfortunately, fluoride's ugly side has almost entirely escaped the public view. As Bryson points out, historians have failed to record that fluoride pollution was in fact the biggest legal worry of the industries that were involved in developing the atomic bomb program. As some may remember, the Manhattan Project was a secret program which brought the atomic bomb into existence. But what most people are totally unaware of is the fact that fluoride was an essential element in the production of the atom bomb.